In April, President Bolsonaro was asked about the rapid spread of COVID-19 in Brazil.
E daí? Lamento, quer que faça o quê? Eu sou Messias, mas não faço milagre.
By May, Brazil's number of cases was the third highest in the world. This virus, which the president had dismissed as a little flu, had killed 17,000 people, and he was being held responsible. The leading medical journal, The Lancet, put it bluntly. Perhaps the biggest threat to Brazil's COVID-19 response is its president. And this is the mayor of Sao Paulo.
When you have two viruses to combat, the coronavirus and Bolsonaro virus.
But can we explain Brazil's plight through Jair Bolsonaro alone? Well, certainly the government's initial assessment of the threat raises questions.
We paid attention to the United States, and the United States, Mr. Trump was very comfortable on saying that he would take care of that. We really thought that he had some kind of science that would be released soon.
But Donald Trump's boast turned out to be hollow. That was the former health minister, Luis Enrique Mandetta. He advocated social distancing and was fired. Next into the job was Nelson Teich. When asked about Mr. Bolsonaro's decision to reopen gyms, he replied, "Was this announced today? It didn't go through the ministry." Days later, he'd resigned. According to O Globo, he objected to the president's promotion of chloroquine. That's an anti-malarial drug, and in March, President Bolsonaro told his supporters the cure is right there. It isn't. But at the third time of asking, he does now have a health minister who's happy to proceed. Chloroquine's been cleared for COVID-19 treatment in Brazil, despite not being proven to work and nasty side effects. Now, being guided by Donald Trump, undermining the health ministry, using dismissive language, a preoccupation with an unproven drug, these are all relevant to understanding what's happened. But arguably, the lack of a nationwide lockdown has mattered even more. The president has sought to undermine that idea wherever possible. This is an anti-lockdown rally in Brasilia, and as you can see, these are not advocates of social distancing. But actually it's Brazil's states, not the president, that have the power to impose restrictions. And they've done so, but to very differing degrees. And there appear limits to what they're willing to try.
Around 40% of the labor force is in the informal economy, only partially assisted by the social safety net. A lot of those live from hand to mouth, so for them it's hard to stay inside the house when you don't have the money to buy food.
Which leads us to the economy. Brazil's currency is the worst performing in the world. Its main stock exchange index has plummeted, manufacturing is slumping, and unemployment is rising. The Brazilian economist Armando Castella has written of his country, "My investment advice would be not to run into a burning building, but how best to put out that fire." The president believes lockdowns will make matters worse, and in purely economic terms, he's right. Ecuador's president, Lenin Moreno, has defended its lockdown, but says it's as if a family has lost half of what it needs to live. And of course, this delicate balance between saving lives and saving incomes is universal in this pandemic. But the bitter political row over whether Brazil can afford a lockdown has had consequences.
At the end of the day, he's the president. People take advice from him as the leader, and that's what's been so confusing. Do people listen to Jair Bolsonaro, or do they take the advice of their state governors?
Around the world, COVID-19 has delivered a deadly lesson that while human beings are influenced by passion, politics and prejudice, viruses aren't. And to explain Brazil's failure to build an urgent, coherent national response, we must start with the president, who hasn't always appeared to want one.